Hi, I'm Neepa Gandhi. I'm a colon and rectal surgeon at Mount Sinai West, and I'm the program director of the Colon and Rectal Surgery Fellowship at Icahn School of Medicine, and also associate professor of surgery. So, how will a patient know if they need colorectal surgery? So this is a very good question. The way that we diagnose colorectal cancer is really with colonoscopy. So if a patient is found to have a mass on colonoscopy, it's biopsied, and that biopsy will then tell us if that mass is a colon cancer. The majority of colon cancers are treated with surgery. This is the standard of care. And the earlier stage colon cancers, stage 1, 2, and 3, are the types of colon cancers that are primarily treated with surgery first. Some colon cancers, which have spread to other parts of the body, may not be treated with surgery first. So, are there some patients who need other treatments before or after surgery? The answer to that is yes. Depending on the stage of the colon cancer, some patients will need different therapies prior to surgery. Particularly patients who are found to have colon cancer outside of the colon, who have been diagnosed with stage 4 colon cancer, do need therapy before surgery, and that therapy is usually chemotherapy. Some patients, after they have had surgery for their colon cancer, are found to have disease that is in the lymph nodes, which are patches of tissue around the colon. And if there is tumor cells found in the lymph nodes, then these patients may require additional therapy after surgery, and that is usually with chemotherapy. So if a patient has surgery for colon cancer, will they need an ostomy? And if so, will it be temporary or permanent? The majority of patients with colon cancer will not need an ostomy. The majority of patients who have colon cancer can have a surgery where we are able to connect the two ends of the intestine together, and they will have normal bowel function without an ostomy. There are some patients where either the colon cancer is large, or it's in a location where connecting the two ends of the intestine may not be possible at the time of the first surgery, where we may use an ostomy as a temporary means to treat a patient. And then usually about 3 months down the road, another surgery is done to reverse the ostomy, meaning the two ends of the intestine can be reconnected, and a patient can then have normal bowel function. In rare cases, particularly in the case of rectal cancer, where the tumor may be very low or close to the opening of the anal canal, those patients may not be able to have a connection between the two ends of the intestine. And in that situation, a patient may require a permanent colostomy. So, what are the risks and side effects that a patient might experience with colorectal surgery? So, there are 3 big risks of colorectal surgery, which are bleeding, infection, and something called a leak. Bleeding can occur because we're taking out an organ that has several large blood vessels going to it. And so when we do our surgery, we use good techniques to minimize bleeding, and we have good instruments in the operating room to minimize bleeding. But in certain instances, we may require that patients have blood transfusion if, again, they do have some blood loss during the surgical procedure. Infection is another risk factor for colorectal surgery. We're dealing with an organ that's full of stool. And so when we take this organ out, there can be bacteria that gets into or around the abdominal cavity or the skin. And so one of the known risks of colorectal surgery is infection. One of the things that we do to minimize this risk is we have patients do a bowel preparation the day before they have this surgery in order to minimize the bacterial load inside their colon. And this bowel preparation consists of taking a course of antibiotics, as well as doing a bowel preparation where they flush all the stool out of their colon, similar to what patients do when they are having a colonoscopy. And the last risk of colorectal surgery is something called a leak. And the best way to describe this is it's like when you weld two pipes together. We're doing a similar sort of thing when we're putting together two ends of the colon. And if that pipe springs a leak, similarly, if that connection between the two ends of the colon springs a leak, you can have bacteria and stool that then leaks out into the abdominal cavity, which can then cause an abscess or an infection. And that may require additional treatment after your surgery. In terms of the recovery process for patients after colorectal surgery, so the big thing that we are looking for as far as the recovery after colorectal surgery is whether or not patients can eat and drink normally and have normal bowel function and have their pain under good control. Nowadays, we complete most of these surgeries in a minimally invasive way, either laparoscopically or robotically. And because of these techniques, most patients are able to get back to their usual diet and physical activity fairly quickly and are really only spending about 4 to 5 days in the hospital with recovery. At home, it does still take some time for patients to get back to their full function after surgery. But generally speaking, after about 4 weeks, patients are feeling pretty close to their usual self after colorectal surgery. So are there any lifestyle or dietary changes that I should make after surgery? One of the things that we would absolutely recommend after colorectal surgery is really to make sure that you're eating healthy, getting fiber, getting water in your diet, because these are things that are going to keep the rest of your colon healthy. One of the things that we do know is that patients who have a higher fiber diet really have less incidence of formation of polyps, and we know that polyps are precursors to colon cancer. So by having a healthy diet with lots of fiber, you can prevent new polyps from forming and prevent colon cancer. As far as lifestyle, we definitely advocate that everyone has moderate exercise. That can, keep your body healthy overall, and also help with your recovery post colon cancer surgery. And when should my next colonoscopy be done? So in patients who have had surgery for colorectal cancer, we do surveillance colonoscopies 1 year after the surgery. And this is, again, to look for any new polyps that may have formed within the colon and to also look at the site of the surgery, the connection that's made between the two ends of the bowel, to make sure that it looks healthy and that it has healed well. After that 1-year colonoscopy, if everything looks good, if there are no polyps that are found in the colon, another colonoscopy, a surveillance colonoscopy, is done at 3 years. And then if that looks good, the next colonoscopy is at 5 years. And after that 5-year colonoscopy, patients go back to their routine screening with colonoscopies at 5-year intervals. Is there anything else that patients should know about colorectal surgery? So I think the important thing is that patients know that colorectal cancer is treatable, and for the majority of patients, colorectal cancer is treatable for 100% cure. The surgical techniques that we have nowadays are minimally invasive techniques, which allow patients to have smaller incisions, faster recovery, and very good outcomes. And when we treat this type of cancer, we treat it with a team of doctors, including surgeons, as well as oncologists. And with that, we really can get patients well and cured from their colorectal cancer.